So I grew up in Cary, North Carolina, outside Raleigh. Went to school for nursing at East Carolina, and then worked for a couple years. I worked at Duke, and then came to New Hanover Hospital, and then went back to get my nurse practitioner master's at Chapel Hill. So I've been here now 5 years, which seems like it's flown, but I've enjoyed it all, and it's been a great ride. I was in 8th grade, and I was taking an allied health science class, and I shadowed a nurse practitioner at a family practice, and I came home from school and told my parents that that was what I was going to do when I grew up. I think I had always been interested in, medicine or healthcare, and that was sort of the defining moment that I remember, when I decided that for sure that's what I wanted to do. When you go back and become a nurse practitioner, then I have prescribing authority. I can work independently. I choose to work with a physician here at Wilmington Health, but I could have my own thing. But I think having that supervision and guidance and different background is really awesome for the patient. It has been an awesome time. We fit really well together. He's high energy, runs through the hospital, and thankfully I can keep up with him. So he's awesome to work with. Patients love him. He's got a lot of knowledge and experience that he is kind enough to teach me day to day. So he is an awesome part of what I get to do just by learning from what he does and the patients that he sees that we are able to share. I'm mainly in the clinic at Wilmington Health. So in pulmonary medicine, the main things that we see are people with COPD or asthma, people that might have interstitial lung disease or fibrosis, things that are a little more abstract. We do a lot of sleep medicine, so if people have sleep apnea or insomnia, we treat that frequently, and a little bit of allergy, but mainly I would say the bread and butter is COPD, asthma, different interstitial diseases, and sleep. I'm fortunate in a specialty that I have a longer appointment time for a new patient, so we can really get to know each other, kind of learn personally where they're coming from. They can get to know me a little bit, and then what symptoms that they're experiencing and how we can kind of navigate through that. We'll often do like a pulmonary function test, which is in the office, to look at their lung function and how they're feeling, and sort of put all the pieces together based on how they feel socially, physically, and kind of put it all together. I hope that they know that they can contact me or my office, that we're an open door, that we are there to help them. I hope that they feel comfortable talking to me and letting me figure out the best way to help them, whether that's a medication or physical therapy or whatever's in line with their wishes. I hope that they feel like I'm listening to that. So I have 2 precious little girls that are my pride and joy. I actually just came back from maternity leave, so I have a 4-month-old and a 2-year-old, and so they are, my everything, as people say. It's true. So I definitely spend most of my time pouring into them and spending time with them. We also like to go out on the boat and, enjoy the beach and the water here in the summer. Just spend time with my family and my husband and be outside with our little girls.